Did you know your ears can reveal a lot about your health? Not just a conduit for sound, our ears can often serve as a window into our overall well-being. While some signs related to ears and health may not be the talk of the town, they still require proper evaluation by a healthcare professional. From the appearance of your earlobe potentially indicating diabetes risk to unusual earwax odor hinting at an infection, our ears can tell us so much more than we often give them credit for. Research has even linked untreated hearing loss to cognitive decline and an increased risk of dementia. Our ears, it seems, are more than just a pair of auditory organs. So it's time to lend an ear to your ears and understand the unique signs they might be indicating about your health. Let's dive into some unique signs that our ears might indicate about our health. First up, we have the auricular crease, also known as Frank's sign. This seemingly innocuous feature, a diagonal crease across the earlobe, may be more significant than you think. It's been associated with an increased risk of cardiovascular diseases, particularly coronary artery disease. Now, you might be asking, how can an ear crease relate to heart health? While it's not fully understood, theories suggest that the same age-related changes which cause blood vessels to harden and form creases in the skin can also affect the earlobes. Consequently, an earlobe crease might be a visible sign of these changes occurring elsewhere in the body, including the heart. It's imperative to note, however, that this association doesn't mean you should panic if you have an earlobe crease. It's just a sign that warrants further investigation. So, if you notice a crease on your earlobe, it might be a good idea to get your heart health checked. Next, let's talk about how your earlobe's appearance could be linked to diabetes. Research suggests that the characteristics of your earlobe, such as its size, shape, or the presence of wrinkles, might offer insights into your diabetes risk. You see, your earlobe isn't just there to hold your favorite earrings or earbuds. It's a part of your body that might hold clues about your health. Now, it's essential to note that these are observations from research, and this doesn't mean that if your earlobes are a certain size or shape, you are destined to have diabetes. It's a complex disease with many contributing factors, including genetics, diet, and lifestyle. But these earlobe characteristics could potentially offer another piece of the puzzle in understanding diabetes risk. It's a fascinating area of study, and while it's not widely recognized yet, these observations certainly warrant further investigation. So, keep an eye on those lobes, but remember, your healthcare professional is the best source for any health concerns. Did you know that creases on your earlobe could be linked to sleep apnea? It might sound far-fetched, but there's scientific evidence that supports this claim. Sleep apnea is a sleep disorder marked by pauses in breathing or periods of shallow breathing during slumber. Now, studies have found an intriguing connection between this condition and the presence of creases on your earlobes. Intriguingly, these studies discovered that individuals with an earlobe crease were more likely to have sleep apnea than those without such a crease. This doesn't necessarily mean that if you have an earlobe crease, you're destined to suffer from sleep apnea, but it indicates a correlation that medical researchers are keen to explore further. The mystery here is the exact mechanism behind this association. What could earlobe creases possibly have to do with your breathing patterns while you sleep? That's a question that continues to puzzle scientists, but for now it's something to keep in mind. Now let's discuss something a bit different, the odor of your earwax. While the topic might seem a little odd, it's actually quite important. Our bodies, including our ears, have their own unique ways of signaling when something's not quite right. One of these signals could be unusual or even foul-smelling earwax. Earwax, or cerumen, is naturally produced by our bodies to protect, clean, and lubricate our ears. Normally it's a bit waxy and doesn't have a strong odor. However, if your earwax starts to smell different, it could be a sign of an infection or other underlying issues in the ear canal. Infections can be caused by bacteria, a fungus, or even a virus. These can lead to changes in the color, consistency, and smell of your earwax. So, if you notice something off about your earwax, don't ignore it. So, changes in the odor of your earwax definitely warrant a visit to your healthcare professional. Hearing loss is not just about ears. It could also indicate cognitive decline. Recent studies have begun to reveal a concerning link between untreated hearing loss and cognitive decline. It appears that as we struggle to hear, our brains may be forced to work overtime, which could potentially lead to cognitive decline over time. Digging deeper, some research even suggests an increased risk of dementia. The exact relationship between hearing loss and cognitive health is still a subject of exploration, but the emerging patterns are clear enough to cause concern. The implications of these findings are significant. If you or someone you know is experiencing hearing loss, it's important to not overlook it as a minor inconvenience. It's not just about maintaining the ability to hear your favorite sounds or engage in conversation. It's about safeguarding the health of your brain and potentially reducing the risk of dementia. This underscores the importance of addressing hearing issues early. So far, we've learned about some unique signs that our ears can reveal about our health. We've delved into the fascinating world of the auricular crease, or Frank's sign, a potential indicator of an increased risk of cardiovascular diseases. Remember, while the connection between an ear crease and heart health is still under investigation, it's something to keep an eye on. We've also discussed how disturbances in taste, such as experiencing a metallic or bitter taste, could be associated with the chorda tympani nerve, which runs through the middle ear and plays a role in taste perception. Our journey led us to the earlobe, where certain characteristics like its size, shape, or the presence of wrinkles might hint towards an increased risk of diabetes. Although not a widely recognized indicator, it's certainly worth further exploration. We also touched upon earlobe creases and their association with sleep apnea, a sleep disorder characterized by pauses in breathing during sleep. The exact connection isn't fully understood, but it may be related to underlying cardiovascular risk factors. We didn't forget to mention the importance of paying attention to your earwax odor. An unusual or foul smell could be a sign of an infection or other underlying issues in the ear canal, warranting further evaluation. We then moved on to hearing loss and cognitive decline, where we explored how untreated hearing loss could potentially be linked to cognitive decline and an increased risk of dementia. This underlines the importance of addressing hearing issues early. Let's not forget about earlobe temperature. Fluctuations in temperature, such as excessive warmth or coldness, could be indicative of circulatory issues or other health conditions affecting blood flow. We also explored how unusual hair growth on the earlobe or around the ears could signal hormonal imbalances, particularly in women. And finally, sensations of numbness, tingling, or pins and needles in the earlobe could be signs of nerve compression or irritation. Remember, while these signs are not definitive, they should prompt further evaluation by a healthcare professional. If you found this video informative, do subscribe and stay tuned for more such interesting facts about health and wellness.